This leads us into our panel discussion now. And the panel is really about redressing South Africa's health challenges and what needs to be in place to support a healthier nation. I mean, we've focused on so much, whether we talk about the numbers that Barry did, the issues of where the gaps need to be filled inside the healthcare system, which we heard so well from our previous speaker, Dr. Dube, and then, of course, Professor Chiliza talking to us about healthcare. But how do we forge partnerships to ensure that a holistic approach to healthcare delivery, one that actually promotes a healthier lifestyle starting from childhood? So joining our previous presenters, obviously Professor Chiliza not with us now, we have got Stavros Nicolaou. He is our panelist that is here today. And of course, Stavros is the Aspen Pharmacare Group Senior Executive responsible for strategic trade development. And he serves on many diverse business and government structures and is also chairman of the Busa Health Forum. Stavros has over 28 years experience in the South African international pharmaceutical industry. And he was inducted as one of the youngest fellows of the Pharmaceutical Society of South Africa and one of the highest honors to be bestowed by the PSSA. And recently, I didn't know this, Stavros, was handed an honorary doctorate of science in medicine from Wits University. Very well deserved, and welcome. Great to have you here, Stavros.
Thanks, Leanne.
Thank you very much. I know, fresh on a trip back from France, so it's lovely that you were able to be here with us. So, now we know we have a high-burden disease. We saw how existing conditions such as obesity, diabetes, and hypertension worsened the outcome of COVID-19 patients. And now in the aftermath of the pandemic, we see compliance to chronic medication has declined. So the question is, are we headed for another crisis? How do we reverse the health conditions of South Africans? And what needs to be in place to support a healthier nation, considering all of these factors? Our panelists will attempt to answer these questions while also looking at how to forge partnerships to ensure a holistic approach to healthcare delivery, one that actually promotes a healthier lifestyle from childhood, as I mentioned. So questions, send them through, put them in the chat, and they'll be sent through straight to me onto my phone. So if you see me looking at my phone, I promise you I'm not sitting on Facebook posting about my weekend. I'm actually reading the questions. So we're looking forward to hearing from you on that chat. Please send your questions through. A very, very important panel. Stavros, we've heard from our speakers. I mean, Barry gave us a brilliant presentation earlier about, gosh, the thing that stood out for me were those top 10 reasons why South Africans lose their lives and how bad our life expectancy is and what an unhealthy nation we are. That scared me. It really is. And then, of course, Dr. Dube giving us an unbelievable presentation as well as to the holes and the gaps that need to be filled in our healthcare system and how previously, COVID, we spoke about that in our very first panel discussion, how COVID really highlighted some of our major problems and how we need to sort this out. So I want to get your views, because obviously we're not hearing a presentation from you, but I want to get your ideas up front on the theme that we're addressing today, perhaps to give us even more ideas of where we can take this discussion.
Leanne, firstly, thanks very much. It's good to see you again. It feels like we're discussing the same topic or a similar one to the localization summit conversation True. You and I had, and it's probably a good segue from last week where we discussed localization in the country, placing localization front and center of our economic recovery plan. So probably a good place for me to start, and let me also just at the outset express my gratitude to Afrocentric for the invitation, and I think more particularly for the thematic that they've selected here. It's a really critical thematic as we try and emerge from some of the ruins post-pandemic. And I don't want to say we're post-pandemic, we're still peri-pandemic because we don't quite know what the next variant will look like. The signs are there that this is down mutating somewhat, but we're certainly not out of the woods and in the clear as yet. And that's why the topic that has been selected today is a critical one, because we can never begin to forge any sort of economic reconstruction and recovery as a country unless we're able to address and aggressively address some of the health indicators. I know it sounds cliched today to say that a healthy nation is a productive nation. I think we've heard this so many times over and over again, but kind of the more we speak about it, Leanne, the less we seem to achieve it as a country. So there have been many wake-up calls and many lessons learned over the past 25 or 26 months. And probably one of the silver linings, if there are any silver linings, that you take out of a destructive pandemic, as destructive as the one we are still in the midst of containing, is two things. Firstly, it has brought to bear in almost a seismic fashion how important it is to address the health indicators of a nation. And secondly, it's also taught us that local capacities solve local problems. And we were highly exposed as a country, as a continent, in terms of our local capacities, and that's capacities both to manufacture vaccines and life-saving medicines in the first instance. And then secondly, we had a high exposure with respect to health infrastructure, human capital and resourcing, capacity to roll out vaccines, for example. I think a strong spotlight was shone on all of those different aspects. Just sort of touching on the latter issue, what's also become very clear and manifest to us is, of course, that when you're managing a pandemic and all the anxiety that goes with managing a pandemic and the panic that sets in, understandably, not only in our own country, but globally speaking, you tend to neglect some very basic things that you need to be doing. South Africa has one of the worst disease burdens of any country in the world. We've got the worst of infectious diseases as we know it, and we also have a rising tide of non-communicable disease pandemics. And I know that my colleagues have covered these, whether it's diabetes mellitus or hypertension, cardiovascular disease, strokes, and many, many others, including mental health issues, which you've just touched on now. We've in trying to stem the COVID tsunami, we've kind of neglected those. And it's not a coincidence that we are now starting to see some of the manifestations of that. I mean, we've got the highest HIV-infected population of any country in the world. We've got around 8.5, possibly up to as many as 9 million HIV-infected people in our country. Put differently, we only represent something like 0.5% of the world's population, but yet we harbor 18% of the world's HIV infection rate. Now, if we don't address these chronic diseases, this new rising tide of non-communicable diseases, our metrics for healthcare that are already looking poor are going to go backwards. And if they go backwards, what happens is not only are there productivity issues on the economy that will stifle economic growth, but you also have to land up investing a lot more money in healthcare spend. You're not going to get the returns that you expect, and it's going to be overall a setback for the country's economic reconstruction and recovery plan. There can be nothing more important right now as you pick up the pieces post-COVID or peri-COVID, as I call it. There can be nothing worse than being on the back foot with your economic recovery plan. So we've got to make sure that we are fully aligned as a healthcare sector, and that's why I'm applauding Afrocentric today for taking the lead on this. There can be nothing worse than if your metrics, your health metrics go backwards while you're trying to recover an economy and you possibly get another pandemic coming along. It's catastrophic. So we need to be super aggressive around addressing the chronic diseases that have been neglected and around investing in the right areas. We need to prioritize investment in health so that we get the right outcomes. So let me end off, because I don't want to be too verbose, I want to end off with two final statements. The first is what I've just said calls for a new type of model, a new collaborative approach, a partnership between the private and the public sector. So the private sector on its own and the public sector on its own cannot achieve this objective of significantly, materially changing the health metrics in the country. It requires us to work together across private and public sector. So we need to acknowledge where the strengths and weaknesses of the two sectors reside. We need to accept that the private sector brings many, many different capacity solutions to the table, and those need to be embraced. And similarly, the public sector, the same applies there as well. Now, we saw this during COVID, where we had the most incredible, immensely successful collaboration between the private and the public sector. We called it Business for South Africa, and there was no differentiation between the private and the public sector. We put our collective capacities to the test and to the fore, and that's why we were so successful in rolling out vaccines. It's unfortunate that we have a big anti-vax movement in the country. Otherwise, we would have been much closer to the 70%. But to illustrate the point that I'm making, we in no time achieved 40% coverage. That was about 7 months ago. We've only shifted from 40 to around 47, 48% in 7 months. Now, that's not an indictment on the private sector capacity, it's an indictment on the anti-vax movement. And their government should have been more aggressive in implementing mandatory vaccines or restricted access to facilities if you're unvaccinated. So there was some semblance of that last night in the President's address to the nation, but one cannot fault the enormously successful collaboration between the private and the public sector, where private sector patients were vaccinated in public facilities and vice versa. That's never ever happened, Leanne. And my final comment I wanted to make is, we need to, as a healthcare sector, embrace local capacities, local manufacturing capacities. We weren't able to access vaccines because we didn't have local capacity in the country. We weren't producing our own vaccines. We cannot allow that to be repeated ever again. So it's going to require collective will and partnership between the private sector and the pharmaceutical manufacturing sector, where we gain independence and sovereignty of manufacturing in our country. Manufacturing of pharmaceuticals should be something we are immensely proud of as a country. And Aspen, the organization I'm representing today, was the first to manufacture a vaccine, a COVID vaccine, on the African continent in record time. It's something we've got to be immensely proud of. But now the challenge is, how do we sustain these capacities? So you want to, as a society, as a healthcare sector, you want to support your local pharmaceutical manufacturers so that when the next pandemic comes around, or whether there's a different manifestation of this pandemic, you don't want to lose that capacity, become import dependent again, be at the back end of the queue, and then you're grappling and scrambling for vaccines that don't arrive. So we have to support local manufacturing in our country. And again, I'm going to applaud Afrocentric for introducing this topic. I know in a pre-discussion we had, they said, please be forceful on this issue, and I am being forceful on it, because we need to embrace our local capacities, sustain them, and ensure we have security of supply. Thanks very much, Leanne.
Thank you. Thanks very much, Stavros. And it is quite amazing how Stavros and I were having the same conversation during it was a proudly South African event, and we were talking exactly about this localization, putting the interests of South Africans first. I mean, we realize at a time like the last 2 years, I mean, these were times where we had to prioritize ourselves, and yet the world was prioritizing themselves, and everybody was grabbing, and it's still happening. We see those that have hanging on to it, and then we just get the little dribbles down, and we can't be in a situation like that again. However, things don't happen overnight, and they can't miraculously change, but we need to work towards them. So I'm really glad that this conversation is happening, and Afrocentric are leading it. So thank you again to Afrocentric for this. But let's delve a little bit deeper, because Barry, you spoke about this, and the private the public-private partnerships is huge. There was something you were saying about having late-night conversations of transferring a patient from a public facility to a private one and the cost associated thereof. I mean, just talk to us about bringing the two together, the costs of that, and how it would ease the burden. Let's go there.
Okay, great. Thanks. That's a useful segue, Leanne. So yeah, there were, early on when we were rising up, one of the early peaks, there was a lot of panic around, will our health system be overwhelmed, public or private? And up until that point, there was no meaningful technical work done to understand, well, okay, if a public sector patient, in this case for treating COVID, but for any treatment actually, if the government ran out of capacity in a public facility and needed to get that patient treated in a private facility, how much would it cost? Who would pay? What would be the mechanism be? And so, yeah, in that moment of urgency, there were a lot of scrambling around to try to figure out those numbers, engage the hospital groups to figure out what their charging structure and prices would be, and then similarly on the Department of Health side to figure out, okay, well, do we even know what it costs to deliver care at that kind of granularity for that specific kind of patient in a public sector setting? Because the way that the finances work is very different. It works according to global budgets and cost centers as opposed to fee-for-service, which you've heard about in the private sector, where we pretty much know what everything costs down to the last tablet and bandage. And so it was an opportunity to have those kind of conversations that really haven't happened much in the past. We know at a macro level, on a sort of per capita basis, the public sector and the private sector operate on about a 1-to-5 ratio, so it's 4 to 5 times more expensive in the private sector. And we know roughly that half of that is due to utilization, so about twice the number of people would go to hospital within a medical scheme setting as they would go in a public health setting, and about half of that is due to price differences. So for example, because of tender pricing, public health pays much less for the same medicine as is paid in the private sector. And then there's other differences that make up those along the way. But generally speaking, the public sector don't outsource clinical work. In other words, they don't, they work according to these global budgets, and only in very rare cases where there's, for example, they run out of stock for medicine and have to go outside of a tender process, or there's a particular shortage of pathologists in the NHLS and they'll have to go to private sector to contract out for those kind of services. So the mechanisms, the financial mechanisms for the two sectors interacting are not mature at all. And that's certainly a place for good conversation, so that the sectors can blend together at need when there's more capacity in one sector than in another. And it's not a one-way street. In fact, very few patients were transferred from one to the other, from public and private, because as we heard earlier, from a bed capacity point of view, we did manage, although human resources took a lot of strain. But there often transfers the other way around. There are good examples like the Red Cross Children's Hospital in Cape Town, or Groote Schuur or Tygerberg, where they're incredible centers of excellence, and private sector doctors will send patients, even medical schemes will allocate those hospitals as centers of excellence for certain disciplines in treating types of patients. So there are pockets of these kind of things, but at a systemic level, we don't have a good mechanism for how patients could flow between one and other sectors. NHI is a possibility where we'll get to those kinds of conversations, but there's still quite a long way to go there.
And that was what I was going to go with, because I mean everything you're describing is almost the groundwork for what an NHI should look like. Dr. Dube, do you want to delve into NHI? Because it's a conversation we need to have. I mean, this is, I suppose, where we're working towards. I don't know how many years it's going to take, and I don't know what it can look like and how fast or what's going to happen in between all of that. But what we've seen over these last few years, is that the theory that NHI should be built on?
Leanne, thank you very much. I think it is a very interesting topic, the topic of NHI, but to what my previous panelists, have alluded to, there are many facets of NHI that actually, because we have started to talk about national health insurance, we need to fix so that when we get there, things could be smoother. one of them, the issue of, how are we going to get medicines? Our systems resilient enough to allow us to, when we get the payment, because NHI is about the payment mechanism and how we organize care, it's important. And Stavros earlier, when you spoke about the issue of, local manufacturing capacity. That's one of them, because when we get there, it will be easier when we can get these commodities locally, etc. But on the journey so far has been an interesting one for us as a country. For me, NHI has been a journey around, can we have a conversation on social cohesion? Because that actually says, can we come together as South Africans and put Team South Africa first? That's basically the essence in healthcare. Can we have a mechanism that says, it's Team South Africa, it's one nation, and in here we're going to delve into what will it take for us to achieve universal health coverage in the manner that is spoken about elsewhere. Number one, in South Africa, we somewhat have universal health coverage, given the medical insurance, given how healthcare is paid for even in the public sector. But we know, as Barry, alluded to earlier in his presentation, it is not enough, right? So in the dialogue so far, NHI is showing some of the features that are there in the system, whether it's in the public or private sector, whereby we are saying in the private sector, we've got sort of an overpriced and perhaps even an inefficient system that we are all working hard to fix. We are hoping from there are going to be lessons. Some of the lessons, Leanne, they've been well articulated in the HMI report, which we are hoping, if we work together, we can highlight those, amplify the changes that we want to see, and transfer some of those lessons to the public sector. But some of it is about how do we make sure there is better quality in the public sector? How monies flow, NHI actually talks about, having, purchasing units for primary health care in provinces, etc., and making sure that those are run efficiently with governance systems and accountability mechanisms that would then take you far, and you could scale that up, obviously, from what we've learned from the Ideal Clinic and what we haven't learned from the Ideal Clinic, and amplify that and make sure that it's scaled up across the board. That is one thing that we are hoping we're going to do. The papers, whether it's the blue paper, the green paper, the white paper that we have produced to date, I think for me it's just number one, I love the consultative approach that we are taking in doing this, and that should be uploaded, because when we do this better, we know that when we are implementing, we've somewhat exhausted some of the issues that we need to be discussing as a country. The second thing I think around NHI is, how do we fix, particularly, all the facets of a health system strengthening, it's about, the health workforce, the human resources for health. And earlier, I think today, I was reading in the news about a case, I think it's a High Court case with life and training nurses, that actually, private sector should also train nurses. That opens up another avenue for us, as a country to dialogue around what is the future health workforce that we want. What does task sharing and task shifting look like in a digitized world when you get nurses in the fore? Because for us to actually get NHI working, we need a diversified and a different workforce. That's one pillar of health system strengthening. I think where some of the controversies have come in around medical schemes existing or not, I think those need to be ironed out, because there is no way we can go back to ground zero for us to move forward. I think we should work with what we have, or at what we have created, the lessons, whether it's the IT infrastructure, the payment mechanisms, the reimbursement mechanisms, the electronic medical records, however far we have moved. And what we have learned in the private medical insurance space is actually phenomenal in us building a health system. I think in South Africa, we are guilty, Leanne, of when we want to build, we first destroy, because we're like, maybe it didn't work. But actually, I think we need to learn to venue shift as a country and use what we have as pillars for growth, or as pillars for building the future that we want to create. There is something about spending that actually is, for me, it's an eye-opener. How much per capita do we spend in the public sector versus in the private sector? That cannot continue. This dichotomized view of healthcare, we know that it is not sustainable long term, but we know that we can't destroy what we have built but it should remain as an aspirational pillar or as an aspirational target for us to build towards that. Because we know even public sector, I'm in the committee for rare diseases. We have seen centers of excellence in Tygerberg, even at Charlotte Maxeke, where we've got professors that are world-renowned and they are top of their game. We want even private sector to aspire to that. But we also want some of the efficiencies that we've created and that we've built in the private sector to remain so that South Africa aspires to that. Leanne, I think for NHI, for me, the message is, can we build one team South Africa that aspires to these health goals that will create, actually that would unlock some of the wealth conundrums that we have in terms of GDP growth, because some of it is stifled by the disease burden. We have got people who are not productive because of the disease burden that we have. Can we actually create that dynamic where now health really creates wealth, and hopefully vice versa? Because when we don't get there, we can never turn our country around. And so NHI is seen as that aspiration. How we get there, how long it will take, it is a challenge, because we've been talking for many years now. Exactly. We know that we don't have money. At times we don't even have some of the skills or even the trust that we need as a country to build that social cohesion. There is a trust deficit that we need to rebuild as a country.
Trust is my biggest issue. And it is, there are so many issues that what you just laid out there. It's unbelievable. And yes, Team South Africa is exactly what we work towards, and we want the ideal of that. However, how do we trust a government that and I ask this to you, Stavros, because I do need, perhaps like everybody out there, and there is somebody that sent this before we even started on this topic. How do we trust a government that stole from a pandemic? How do we put our trust in them and think we're working toward Team South Africa, but are we doing this alone? Natasha asking this question: how do you stop the corruption in public as well as in the private sectors? Look at all the corruption that happened in COVID. And this worries everybody. It really does. So Stavros, I ask you this. Yes, NHI, and I hear the concerns from a lot of doctors and medical professionals that are saying, the dream is there, but the road to it is paved with self-wealth and corruption. So how do we get there?
Leanne, I think it's kind of the $1 million question, isn't it? Because corruption is not only rife in the healthcare sector. It's we were talking about pandemics earlier. Well, corruption's one of the biggest pandemics we face in our country, unfortunately, and it's something that business is very seized with, because investors are telling us they don't want to invest in South Africa because they're not sure that if they make an investment here, that it's not going to be riddled with corruption, or there won't be wastages and maladministration that leads to corruption, right? So this is not only endemic, and excuse my parlance here, because I'm using pandemics and endemics in a corruption context, but it's endemic, unfortunately. So the first area we've got to address is the judicial system and the enforcement system in our country needs to be significantly upscaled. So, and I'm talking about basic things like there's open corruption that everyone knows exists, but there's not a single conviction or sentencing that happens. So the very first thing that we have to address as a country, and this will speak to healthcare, and it will give confidence to the private sector, particularly foreign investors who want to come and invest in our country and are telling us, we're not certain we're going to be here because you guys, you're so corrupt that we're not sure the money is going to get to where it ought to go to. So we've got to build up capacity in the judicial system, in the enforcement agencies, so that we can start getting these convictions. Now, the private sector recently made some overtures, and it found expression in the President's State of the Nation address, where the private sector is saying we will make capacity and skill and experience, we'll make that available sometimes on a pro bono basis, so that we can get that capacity and that capability to start bringing people to book. So that's the first thing. The second thing is that our whistleblowers in South Africa are not protected. If I ever look at what goes on in other countries, there's whistleblowing protection schemes. Here we've got witness protection schemes, but we don't have whistleblowing protection. And very often people that have blown the whistle land up being victimized, and sometimes even worse than that, right? Now, we cannot afford to have that. We saw in our very own sector where a government official, a healthcare official, was assassinated. She was taken out when she blew the whistle. And we cannot have that. In other countries abroad, you are rewarded. You get significant sums of money for blowing the whistle. Okay. Now, I know that leads to a different type of problem, in that people are going to try and settle scores by whistleblowing, etc. Here I'm talking about legitimate whistleblowers that have got bona fide evidence. We need to protect those people. So in summary, Leanne, what's going to bridge the trust deficit somewhat is if the public and the professions, if they start seeing a capable state that is able to convict and sentence, and the private sector must play its role. And we saw that, Barry and I were part of Business for South Africa, where, Barry worked endless hours on a pro bono basis. He didn't ask for payment. Okay, he did it because it was the right thing to do, to Dr. Dube's question. It was SA in coming together and saying, listen, there's a common enemy that needs to be defeated here. It's a virus called COVID. Well, there's another common enemy that needs to be defeated, and it's called corruption. So where we have got capacity and capability, let's put that to good use, even if it means some of it is pro bono and others the law firms charge. But we had law firms in Business for South Africa that did this for pro bono. Now, I'm not saying they must all do it pro bono. They also got to earn a living. But the point I'm making is we need to have a capable state that can convict and sentence, and we need to have protection for whistleblowers. The late official that I'm referring to, Babita, okay, imagine how her family are feeling today, because not only did the poorest of the poor suffer because there was corruption, but now there's a family that don't have a mother, they don't have an aunt, they don't have a sister because of failing to protect whistleblowers. So, Leanne, those are the first two things we need to do, and it applies to healthcare as well. That will start building trust, I believe.
Yeah, absolutely. Gun down in your own driveway for doing the right thing. And yeah, that's the reality, and we do need to. So I certainly agree with you. Here's a question, and I'm not too sure whose presentation it came from, but it was quite in the beginning, so I'll leave it to either of you. It's aimed at one of you here. Somebody anonymous posting a question saying, in my own area of maternity, a lot of elements that you need to achieve espoused integration of the value chain in place. Are you ready to take on real projects and champion them with the schemes you administer? If not maternity, are there any other examples that illustrate defragmentation as you have defined where you have partnered with providers? Sure. That's you.
Sure. I think that actually speaks to our business model at Afrocentric Health. So maternity and women's health, this is actually something that we want to do well, because it's a cradle to grave kind of approach where, a mother, when she's pregnant, take care of her, take care of the child, etc. And that is something that we've been looking to partner with providers on and ensure that the payment mechanisms are right for that. By the way, I guess what the listener is talking about here, Leanne, is about, so South Africa has got one of the highest cesarean section rates in the world. Yeah. Forget like even in the region, in the world. And it's a cause for concern because that makes pregnancy very expensive in South Africa to reimburse, to pay for, and even the what you get after cesarean section is not natural, right? So the side effects, the length of stays in the hospitals, etc. So what that actually requires long term is partnering with providers, whether it's OBGYNs, and there is a reason why we've got a high cesarean section rate. In an environment where there's trust deficit, obstetricians are being sued left, right, and center for anything that may go wrong during birth. And then they opt for the safer mechanism, which is cesarean sections, and now it's spiraling out of control in the country. And for us to get out of that, we need to partner better. We need the medical licensing insurance for obstetricians to come down. I think they pay more than $1 million per year. And so before an obstetrician sees a pregnant woman, they have to cover the base of almost $1 million per year for them to be able to practice. So that it's a complex problem that actually cannot be solved by one solution. It needs us to co-create with providers, with medical insurance payers and medical schemes for us to come up with a solution that says, could we reward better? Could we align incentives for members, for obstetricians, or even can nurses deliver babies? I think my own grandmother was a midwife, right? She delivered babies in the village. And I think we know that nurses, actually midwives, that's why they are midwives. They deliver babies. And in this country, you find that midwives are not employed to do that. Rather, they just assist the doctor because of these undue incentives that we are seeing in the private health space. But at Afrocentric, there are many programs that we are advancing in an integrated fashion. These include how we manage chronic health, from medicines to how we put in nudges to our members for compliance to increase, and also partnering with doctors and rewarding them better around the outcomes that come out of chronic disease management. Mental health that Prof. Chiliza was talking about is another innovation that we are advancing at Afrocentric, so that we not only reduce costs, but improve and have more efficiencies on how we identify, diagnose, and even treat mental health. So there are many of these. And again, to the listener, I think what we have to do as a country is have that seamless, it can never be completely seamless, but a seamless flow of what you need as a purchaser of healthcare or as a consumer of healthcare, from when you need, you've got a problem to when it's monitored and outcomes are actually felt. And we've got many examples of those to show, which we want to scale up and we want to set out as examples that could be emulated also in the public sector, as we were talking about the South Africa that we want to create.
Yeah, interesting. Very, very, very good response, I think. I hope that answered your question adequately. I must say I learned a lot from there as well. And also that it seems to be like a little bit of a clash between midwives and gynaes. I don't know what goes on there, but I remember that in those days was like, you leave your midwife, I'm doing the job, not them. I was like, okay, I don't know anything about it, so it's good to be educated about it. One of the things that really surprised me, and Stavros was saying it, but Barry highlighted it to us, is and I've noticed it. I mean, South Africa wins the wrong things. We always win the wrong competitions. I'm not talking about sports. I'm just talking about we come first when it comes to the highest HIV/AIDS infection. We come first when it comes to this. Come first when it comes to all these unhealthy lifestyles you're talking about. And it just is diabetes. I mean, all of these kind of things. Where are we going wrong? What are we doing wrong? I mean, obviously I know the education behind it. I know what it is to lead a healthy life. And yes, of course, I dropped the ball like many other people. But what is it that we as a country are doing wrong when it comes to the things that are highlighted on that list of the top 10 things that are killing us, that are actually easy to avoid, and yet we don't? Why? What's wrong? Where are we going wrong?
That's a great question, Leanne. Look, I think South Africa has its own history, complicated, unfortunate history that it means starting way behind the line compared to other low middle income countries in terms of being able to get ourselves into shape, metaphorically. So there are just so many things at a macro level to fix that require enormous attention. which is why I try to include those kind of topics in my presentation today, not just talking about the health system in particular, but the biggest bang for our buck by some measure to improve the health of South Africa would be to fix the social determinants of health that I mentioned. You just can't, it doesn't matter, yes, local supply of medicine, vaccines, production is absolutely critical within that microcosm. It will create jobs, it will on its own fuel economic activity, etc. But when 55% of people are living on 1,300 Rand a month at a macroeconomic level, there's only so much you can do. 30% of South Africans are still smoking, which is much higher than the global average. That should be a problem that we can fix. Like we said, 25% of South African adults, 27% thereabouts, are HIV positive. That's an infectious disease. That's a very solvable problem. It drives TB because of the lower immune system in HIV positive patients. Those kinds of things can be fixed both with good policy and good implementation, which is why I try to emphasize those. We're neglecting large areas of the inputs into overall health and well-being by, for example, not thinking carefully enough about agriculture. I mean, we just don't seem to have a plan on agriculture. We focus so much on, when last did you see agriculture in the news? All you see is mining, for example. But agriculture, growing food locally, growing healthy food locally, as opposed to the cheap calories that people buy from processed carbohydrates and many, many other things like that. If we can solve those are where we'll get an enormous bang for our buck. These big themes, agriculture, good food, if you speak to a dietitian or even a physician who's interested in physical health as opposed to treating sick patients, nutrition is 80% and exercise is 20% of maintaining your body in a healthy lifestyle kind of way, and we just don't pay it any mind. Within the health system, the human resources for health is probably the best bang for buck strategy, both in terms of producing the right level, number of resources, the right mix, and then getting them to work together effectively within the public sector, hiring the right people for the right jobs with accountability frameworks, and in the private sector, getting them to work much more effectively in teams. But yeah, at a macro level, it seems like we're always behind the curve. We react too slowly. We take easy decisions, not the bold decisions. We prefer to, not be at the front. It seems. I don't know, Stavros, what your experience is in those policy circles, but there's always, diplomacy seems to outrank leadership and being bold and making aggressive decisions to really turn the tide on these things. Would be my read on it.
Stavros, you want to add to that?
Firstly, I'm going to fully agree with Barry on that. Case in point, Leanne, is what I mentioned earlier. We know the benefits of vaccinating the population. So it's probably the best known fact in medicine that nothing has saved more lives other than clean running water than vaccines have. And yet when we're faced with difficult policy choices, such as a mandatory vaccination, or even restricted access to venues for unvaccinated people, we defer on the side of ambivalence almost. And say, well, let's consult, and that's the problem generally in our country right now, is that we have a problem implementing policy. Very good policies, many good policies in health, in economic reform, structural economic reform, but when it comes to the actual implementation, we often get extremely overly consultative and you land up not implementing the policy. So if there's any takeaway we need to takeaway message from today would be, in my opinion, is we've got to start walking the talk as a country. Talk less, implement more, and that applies in healthcare as well. We'll sit and debate some of the most obvious things. I don't know, certificate of need, for example. We'll debate it endlessly as a country. When there are much bigger issues we should be debating in detail. So we've got a crisis almost of taking difficult choices and making hard calls on the one hand, and on the other hand, we very often don't place the right focus and emphasis on priority areas. And then that kind of morphs into, managing 50 priorities when you could be managing 3. So those are the things we need to get to grips with as a country. That will improve many metrics, not only in healthcare, incidentally, but elsewhere. I know President Ramaphosa is trying that. He's trying to do that with this administration. But it's the layers. It's what I was saying earlier, Leanne. We don't have a capable state. And a capable state is built up around competence and capability and having the right people, the right skills in the right positions. And that's what we're not getting right as a country. And we can get it right. There's just so much talent in our country. There's so many good skills. I've seen that at Aspen, where you find we own factories in Germany and in France, and you find that your locally trained people land up being as good, if not better, than the skills that you've got in Germany. Now, isn't that a fantastic note to end off with? So we've got the skills, we've got the capability in our country. We just need to make those difficult choices and implement.
Absolutely. I think a nice way to sort of wrap that up. But I'm going to ask each one of you, because we basically got 3 minutes left to summarize these points. I mean, there were a lot of things that came through on the line here. I mean, there was even one basically talking to the issue of, ambulances, there's not enough ambulances. There's not enough training for nurses. We take too much away from them. The corruption, the this, the that. There's a lot. I think we've encompassed quite a lot of it in our panel discussion. But if I can, and let me begin with you, Barry. If we had to, there are so many issues, but if we could tackle one, if there's just something we can walk away with today, and you could say, this is the main priority area. We all came together with COVID. The world basically stopped to create a vaccine so that we could roll this out, and it's there and it's working, and we see this thing going down, and hopefully it carries on in that manner. But if we as a country, not a world, as a country, had to focus on that one thing that could almost change the trajectory when it comes to healthcare, what is it? And perhaps I'll get that to all of you, and you can just round off for me. I know it's a tough one, but there are so many. But just give me one at the moment that we need to work on. I love the agricultural one. I think that was amazing. I'm just looking at how much we import wheat from Russia and the Ukraine, and I'm wondering, what's wrong with our land? Can we not do that ourselves? But I know nothing about agriculture. But, these are things we need to think of ourselves and look after ourselves.
It's really hard to pick one, Leanne.
I know it is. So give me a few if you want to then.
Okay, you let me off the hook. Look. In the short, or maybe let me do it from a time point of view, because these things play out differently over time. For me, the number one priority in the short term is to sort out HIV and TB. It makes no sense that we've become used to it at 25% and 130,000 deaths a year. It makes absolutely no sense, and we have the tools and capabilities to sort that out. So in the very, very short term, you get big bang for your buck not to just carry on with the situation we are. In the medium term, non-communicable disease, I think for me, if you're going to pick one thing to do, yes, the system needs to be fixed, etc. But we have to fix what we're putting in our bodies. It makes no sense to be eating the way that we are, with sort of junk food on every corner and highly processed carbs and these kind of things. Or whatever your particular diet proclivity, because even there's the controversy around what constitutes a healthy diet. But certainly we're not putting the right things in our bodies, and it's driving the non-communicable disease. If I had to pick one thing, maybe when I retire, that'll be what I'll spend my time doing. It would be, locally produced healthy food for a community. We have examples in Hout Bay, where I stay, that are fantastic examples that are very inspiring.
Amazing, stunning. There you go. You did it. Well done. Doc, what do you think? Give us that same thing and just wrap it up for us from your side.
So, Leanne, you know that Barry cheated, right? So,
Did he cheat?
So Barry cheated and picked 2. So, and NCTs abroad. I would actually start with NCTs, because I somehow think that for HIV and TB, we know exactly what we need to do. But most of it speaks to the structural problems and challenges that we have in our country. NCTs, because the spin-offs are broader than just the disease itself. It's about where people live, what they eat, whether they exercise. And that, what it does, it changes the way people perceive themselves and the way people perceive South Africa. But if you were to say, where would you put, what is the best spy in healthcare? For me, it's leadership. So we need leaders who will bring a heart, because we cannot solve these complex problems that we've articulated today with one solution. There is never a silver bullet. So we need leadership. We need leaders who are going to bring a heart to South Africa and inspire a new vision around this. And if I were to solve for NCTs, I know exactly that it's complex and it's multifaceted. Therefore, it requires me to lead with a vision, bringing in new partnerships around the table, making sure researchers are needed here. Private sector is needed around how we treat disease, but most of the money will go to how are we going to prevent disease. So leadership in encircling all these challenges and making sure that the child who is 8 years old today thinks differently about what they buy and put in their stomachs.
Absolutely love it. Absolutely love it. I remember this was just before COVID. I think, no, a little bit before that, Dr. Aaron Motsoaledi was our health minister, and he came on and we were talking about HIV and AIDS, and he came to launch the biggest thing that was going to change the trajectory of HIV and AIDS, flavored condoms. I was like, Minister, seriously? Strawberry and peppermint and banana, and he came there showing me these condoms of his, and I'm like, okay, this is, yeah. So yes. Okay, whatever. Didn't work though. It's still there. It's still up there. All right, Stavros, on a serious note, back to grounding us here. What would you choose? What would you do?
Leanne, listen, mine's not going to be anywhere near as exciting as flavored condoms, right? But I think you and I can send our CVs to Barry when he starts his hydroponics.
Yeah, we'll give it a go.
Leanne, I'm going to be rather dull, boring, and sterile and discuss the basics that we need to do here, right? And let me preface what I'm going to say, but we actually did a lot of good things as well during the pandemic. And we were lauded globally for some really good medical excellence, such as, for example, we were the only emerging market that ran clinical trials for the Pfizer, J&J, and AstraZeneca vaccine. There's no other emerging market. So that speaks to the excellence of clinical trials, the scientists, the capabilities, the academic capabilities we've got. We ran the biggest phase 3B study in the world, and the world benefited from this. We were the first to produce a COVID vaccine, Aspen was, on the continent, in the southern hemisphere. So there are a lot of positives that you can take out, right? But let me answer your question directly by saying we need to do three things. Okay, number one is we've got to bridge this trust deficit that exists between the private and the public sector. We can't say the one is better than the other and shut down the one and keep the other one. Okay, we've got to recognize that both have strengths, and how do we best leverage those? But it must be a discussion without any self-interest, and a discussion that says what is going to give the best optimal outcome, not the best ideology. So that's number one. Bridge that trust deficit. Sorry, before I move off that point, there is a track record now of public and private having worked together. So that gives me a lot of hope that you can start bridging that trust deficit. The second thing, Leanne, what I said earlier is, let's start implementing policies, start talking less and implementing more. And then the final thing is, let's make the difficult and hard choices we need to make up front. Because the more we defer those and delay them, the worse the situation gets. Like Barry's right. I mean, how can we be sitting 22 years down the track? I mean, we realized we had an HIV crisis in 1999. So, sorry, it's 23 years actually. How can we still be sitting with 130,000 deaths a year? It's unacceptable. So let's make the difficult choices. Let's invest in the right areas. And the biggest message I want to leave you with today, Leanne, is healthcare must be seen as an investment, not an expenditure. Unfortunately, far too many people see it as an expense. It's not. It's an investment in people that will grow this economy. And there could be no bigger priority right now than recovering the economy and getting it back to 3% and beyond growth. Thanks very much.
Stavros, thank you very much. Dr. Dube, amazing. Thank you, Barry. Thank you very, very much as well. And most importantly, thank you for watching, sending in some of your comments and queries. It was absolutely amazing. I thoroughly enjoyed this panel discussion. I hope you enjoyed it as well.